In 2003, I was on bed rest for 5 months. And when I got off bed rest, I started having some really bad hip pain, what I was calling hip pain. I've always been an active person. I love to play tennis, I run, and throughout the pain, when I started experiencing such severe pain, for the most part, I tried to keep up those activities. What I found was if I sat on the couch, I hurt just as much as I did if I was on the tennis court or going on a long run. It was hard. It was hard. It was depressing to be out there, and everything I did would be persevering against the pain more than the actual activity itself. After about 2 years, I started experiencing the pain in both hips, and it was getting worse and worse. I finally went to a hip specialist, and I had MRIs and x-rays and checked for arthritis. My back was looked at, and I had epidurals, and I had cortisone shots, and I then tried physical therapy, and I was a perfect physical therapy patient. I did everything I was supposed to do. I gave up running. I gave up all impact sports. I love to play tennis, and I gave that up for the PT phase. I would get a little bit of relief. You know, they'd do the stimulation, and they'd tell me the stretches that I needed to do, and I did them all, and I'm very healthy. I have a very healthy lifestyle. I eat well. After that PT, still a ton of pain. Experiencing this pain, I never personally, now this is going to sound severe, never personally considered suicide, but I understood why people wanted to take their own lives because they couldn't live with pain. I mean, I have a great life, and like I said, I'm active. I have a great little boy, but the pain was so bad, I could not imagine the rest of my life. And here I was in my mid-30s. Could not imagine the rest of my life like that. I tried 3 different physical therapy practices, and all very excellent physical therapists. And finally, I got to the point where now I'm in my early 40s, and I'm thinking, I just have to look at this as pain management now, because nobody can figure out what's going on. It doesn't come up on the x-rays, the MRIs. When Dr. Friedlis said, I know what's wrong and I can treat it, I was excited because I knew he got exactly what I was talking about. He became my savior, in a word, when he just got it. So he is so friendly and so personable, and spends a lot of time with me understanding the problem. And he described my pain for me. He told me, he's like, I bet it hurts here, here, and here. And he pushed on some pressure points that I didn't even realize hurt. And when he pushed on them, I said, yes, that hurts. And he said, you have pelvic instability, and I can treat it. I can do PRP, and I can treat it, and it will be gone. Unlike all the other doctors, we were focusing on the hip, or the physical therapist focusing on the certain muscles that need to be loosened and limbered and stretched a certain way so that things would fall back into alignment. Well, my problem wasn't that I was out of alignment and couldn't do all the right things to get back into alignment, because I could. But it wasn't until Dr. Friedlis told me that, yeah, you're getting back in alignment, but your ligaments aren't able to hold you there. So you get these temporary moments of relief, and then things just go right back to setting off all the referral pain areas that hurt again. So I started thinking about it, yeah, completely differently, that this was the solution of setting my body right again, and my body's ability to hold itself in place. I can't believe the results that I've had from Dr. Friedlis and the PRP experience. So I've had 5 sessions of PRP, and I'm hesitant to say I'm 100% better because I don't want to jinx myself, but I would say a good 90%. I wake up, and the first thing I think of is I don't feel pain. I mean, most people wake up and say, ooh, this hurts. I wake up and I think, it doesn't hurt. The results of the PRP therapy have absolutely made every aspect of my life easier. It's just the simple activity of going to a movie and enjoying the movie, and not being the person sitting in front of you that's moving all over the place and continuously shifting around, and not being able to even enjoy a movie or a dinner out. So yeah, it's affected all aspects of my life. I can just enjoy life being normal and pain-free. It's amazing.
Miss Allen's case represents a typical case that we often see with women and pelvic pain. The patients come in after having had one or more children or having had trauma to their back or pelvic area. A good fall on their butt might be all it took. But they come in with these mysterious complaints of hip pain and groin pain and back pain and buttock pain, and they bounce around getting a shot of cortisone in their trochanteric bursa, in their gluteus medius tendon, in their piriformis, and they get trigger point injections, they get physical therapy, they get chiropractic, and nothing seems to really cure them. And the reason is that they have underlying instability of their pelvis. Now, the pelvis is made up of three bones. The two iliac bones, which are the sides of your pelvis, and then the sacrum, which is the base of your spine, and everything fits together in a ring. That ring is held together with some ligaments, and often these ligaments can get stretched out, particularly with childbirth and carrying babies, and then the pelvis becomes a little unstable. When that pelvis starts to wobble, they'll go to the chiropractor, go to the therapist, they'll be told their sacroiliac is out of place, their hip is out of place, and they'll get some improvements, but they'll be short term. They'll get a shot of cortisone here or there, and again, short-term improvements. The reason these problems keep coming back is because nobody has addressed the wobble in the pelvis, the instability. Until you tighten that pelvis down and make it stable, the rest of these problems simply won't go away. So how do you stabilize a pelvis? Well, there's some miraculous injections we do with growth stimulants, and they're aimed exactly at the ligaments which hold the pelvis together. And if you can tighten those ligaments up, make them shorter, make them tighter, make them stronger, then the pelvis holds down and becomes tight, and that becomes a good base of support for for both legs, for the spine sitting on top of it, and all of these other problems melt away. It's an injection of basically a product exactly from your body. It's what we call a biologic stimulant. We take blood out of your circulation, we remove the platelets, and then we concentrate those platelets, and then under very targeted and guided imagery, we take those platelets and inject them into the specific ligaments that hold the pelvis together. And that has to be done 2, 3, 4 times, and the patient will get progressively tighter and tighter and leave all their symptoms behind. It's a very powerful treatment. It has helped many, many women regain their life, regain their sport, regain their happiness.